Hi guys, welcome back to my channel Obgyn Made Easy. In today's video, I'm going to discuss one of the cases I encountered about 6 hours ago. It was a twin ectopic pregnancy. The reason I want to share this video with you is because a twin ectopic pregnancy is a very rare condition. And also it was the first twin ectopic pregnancy I've encountered. So twin ectopic pregnancy is a very rare condition. It occurs in about 1 in 125,000 pregnancies and occurs in 1 in 200 ectopic pregnancies. So the patient was a 30-year-old, a G3 para 2 at 6 to 7 weeks gestation age. She wasn't sure about her last menstrual period, but according to the history we gathered, it put her about 6 to 7 weeks gestation age. There was no significant medical history or surgical history, but the thing we gathered was she was RVD reactive and on antiretroviral therapy. So she came in with complaints of severe abdominal pain and vomiting for 1 day. On examination, the blood pressure was 98/66. The pulse was 108 beats per minute. The general condition was that she was fully conscious. She was very pale. There was no jaundice. There was no cyanosis. And the capillary refill time was delayed, which was 5 seconds. And the peripheries were cold. So as you can see, the patient had features of hypovolemic shock because of the low blood pressure, the high pulse, as well as the pallor, the delayed capillary refill time, and the cold peripheries. On auscultation of the cardiovascular system, S1, S2 was tachycardic. On abdominal examination, there was low abdominal distension. The abdomen was tended to touch and it was rigid. The uterus was not palpable. Vaginal examination showed a cervical motion tenderness. There was no blood, and we attempted caudocentesis, which came out negative. There was no aspirate. However, when we did the paracentesis, we aspirated about 10 ml of blood. The gravity index was positive, and the hemoglobin level was 3.1. So we made a diagnosis of a ruptured ectopic pregnancy, and we quickly took her into theater. So as you can see, we did not have to wait for ultrasound to confirm our diagnosis. But because of the clinical features, the state the patient came in, the paracentesis, the positive gravity index, and the low hemoglobin, it confirmed our diagnosis of an ectopic pregnancy, of a ruptured ectopic pregnancy. So in some situations, you don't have to wait for ultrasound. You can quickly take the patient to theater. So what were the intra-op findings? So we did an exploratory laparotomy, and the intra-op findings were hemoperitoneum of about 2,000 ml. There was a ruptured left ectopic pregnancy on the fimbrial end, and there were two non-viable two embryos, as you can see in this image. This is the first embryo and this is the second embryo. And there was placental attachment to the mesentery. So what did we do for the patient? We did a salpingectomy and transfused her whole blood, about 3 units. So this comes to the end of our video on twin ectopic pregnancy. Thank you for listening, and please don't forget to subscribe. Thank you.